nyina karagaine abagamba nti abaragaine kandi tebaba n'engeri bakugamba weeyo bakuleka tebeetana. So niko kayire tusobole kuba tutaha mu studios kulwa nti twasobola kuba tuyitiyaho enteekaniza enyata bwongo. Kiro kino tuyina ekitweta enyata bwongo Christmas special. Kandi eno Christmas special etandikira kiro kino egenda kuba neribata throughout the festive season eno ya Christmas etulumu mabara nkabuli kiro Kenneth Nwagira Moti tugenda kwa tulibata bali tukandi abo enteekaniza ya kiro kino abarungi abaroko kiro kya jomba yani yabagamba nti ngenda kuba nimbatungirayo abasaho kuruga mu mahanga gakawukana abasaho abakugumuno iyo baraburoko olina omurwaire wa maiso niko kayire kanu kanda sobole kuba anoika TV yawe osobole kuba anorura abantu abunkuretire mu studios kandi buli kimu kisobole kuba nikikulibatira kurungi muno. Engeri kabagambire Kenneth Nwagira nero ibara lyange kandi mu studios nyina abagenyi kandi bana abagenyi bagenda kwanda baza olurimi olujungu. They will only be speaking English, that will be the language. However, I will only be interpreting for you people. Whoever does not probably speak English, I will be here. That's why I am seated in here, and I will make sure the translation comes to you as per when you need it. Ngenda kwande ngo muno kurora nti bintu binu bagenda kwana baza olurimi olujungu baitu kandi ngenda kulenga muno ku rutaputa bali banta bakuruga mahanga akawuka nina doctor kuruga mu yanga ya United Kingdom ya doctor kuruga Pakistan nina doctor akuruga mu ihanga area United States of America kandi nyina ho nomu omukuru andi ha mukono gangu gobulyo kaire kona ngenda kwa nimweza kabisa na wasobole kuba na yanjura baramara kuba na yanjura ngenda kugama niwo habuli kimukiona kibazoho baitu kandi ngenda kwa ntajamu omugenyi ondi na wasobole kuba na tugambira kiki kandi kibahimbira kuruga mu mahanga gwarugiremu kurwanti baitu kandi ensonga balesire eri nsonga y'ububaire bwa maiso abagenyi banu balesire habwa kiro kino not because we are trying to give you the other bit of it baitu kandi eri nsonga ya mani muno nti kikwetagisa iwo muntu aroko nyondi muntu ayarwira maiso kumara emyaka bwire bunu kubara emyaka 12 banu abasaho omuharibo ali musaho omukanda kasobora kuba ananjanjaba basobora kuba ne bansemeza maiso gano niko kurranti nabwire bunu nyina kalendereza kunkoroleraho nkugamba nti buli buyambi obasobire kuba ne bampereza anyuma yokulengaho kulwana kurwanti nyatunga obujanjabi obukwawukana baitu kandi nyasobora kuba ndemesebwa baitu kandi abasajja bano bankwasiremu abwire bunu bali kwikara mu studios amukamera n'ikara kulungi ebitara bisobora kuba n'ibintu norano ya munyikirize ngende mu rurimi rujungu baitu kandi ngenda kuba nimba neneko kuba nimba umawumiramu kwetegereza enteekaniza engerere bwire bunu kangende mu rurimi orujungu. I have about 4 guests in studio and most of these people, the 3 of them on my right from the far right, they are all doctors. They are qualified doctors from as far as America, from as far as Pakistan, from as far as United Kingdom. And I definitely will be giving them opportunity to introduce themselves over to you. And you can as well understand who these people are. We shall as well be getting to know who they are, why they are in Uganda. I am, like I told you earlier, for those of you who picked their first languages I spoke, I didn't speak one language as I was making my introduction. I am a Mbalkiringo person, and I was telling them about the beauty of why you are in the country. That is if I am to make you feel home, because I understand the language was kind of far from your understanding. But then, I already told them why you are here, what they should expect from you, and at this point in time, I will be giving Mr. Navid an opportunity to introduce himself over to our audience so they can understand. Like I said, on my right, from the far right, the first 3 are doctors. It is only him on my near right that is not a doctor, but he is the chairperson of people from Pakistan. He is the chairperson of Overseas Pakistan Global Foundation. I definitely will not want to speak much about the foundation, where the chairperson is here. For that particular matter, I hand over to you, tell the audience who you are, what the foundation does in Uganda first and foremost.
Okay. First of all, good evening everybody, and I think in your language they say Jebariko.
Jebariko, that is Uganda, exactly.
Now, let me introduce myself. My name is Navid Minas. I'm the chairman OPGFA Uganda. And like we have now free ice camp. We have in Mayoge district for 2 days. After that we was in Jinja. Now we are in Malago. Today it was our second day. Tomorrow we are again there.
Okay. That is Mr. Navid Minas.
Yes.
He's the chairperson of the Overseas Global. It is the Overseas Global Foundation. Africa. Yes. The A is Africa, not Asia.
No, not Asia.
That is what confused me first. Okay, that is Africa, and he is the chairperson of the good people from Pakistan, people that have willingly decided to come and give a hand to Ugandans, help out Ugandans, especially Ugandans with sight problems. I told you people I had a problem with my sight for over 13 years now, but until I gotten people that worked on me, I know the pain people with sight problems go through. So it is one reason why I chose to have these people come to studio so we can have most of the issues talked about. And please, it is a good initiative. These people are here and they will be letting us know why exactly they're here. And I will go to my second guest in studio. It is now your time to introduce and tell us who you are. I understand you're all doctors. That is, for me, I know you. But I want the audience now to know which people are hosted today. Over to you.
Hello, my name is Sohail Chaudhary. I practiced medicine in UK and retired more than 10 years ago. After retirement, I felt that I still can give something back to the world. And with that in mind, I set up a charity called OBWAMAISO. We hold camps in Pakistan, in Kashmir, and we have been to Africa twice. We have been to Tanzania, then we went to Kenya, and now OPGFA have invited us to come here and serve the people of Uganda. So we are here with all our team to hold free eye camps, especially for people who have reversible causes of blindness, mostly cataract. On doing some research, I found that in Uganda there are about 400,000 people at one time who need some kind of intervention and their blindness can be cured. So our charity provides these people with the necessary treatment, mostly cataract surgery, and we try our best to provide it free of charge. I know there are good hospitals, there are good ophthalmologists in Uganda, and they do provide a good service. Our service by no means replaces their service. We are foot soldiers. We try and provide a service to people who cannot afford it, and we provide them free treatment. And I'm thankful to OPGF for giving us an opportunity to do this work.
Very interesting. That is Dr. Sohail Raza Chandri, and he says he's from the United Kingdom, where he's been doing his medical care services. And he says he has a charity organization that has so far moved to Tanzania and Kenya. And now that they are here in Uganda, it is high time our fellow Ugandans took charge and took responsibility. If you have a patient there with sight issues, with visual impairment problems, it is high time you brought him up or her, so he can be worked on with, we have people who have the best experience in terms of sight issues. I don't want to go about the other terminologies where they say, is it ophthalmologist, something? You become
ophthalmologist and eye doctor.
I would rather go for opticians.
Optician is something different. Optician provide glasses. Ophthalmologist give treatment.
Surgery and other
And
treatments.
medical treatment.
Okay, and the other guest with a beard like mine, I will also give him an opportunity to introduce himself as well. He is from Pakistan, I understand.
Thank you. Good evening, everyone. My name is Dr. Zohaib Hassan, and I am from Pakistan. I am consultant ophthalmologist and practicing in Pakistan. And for so many years, I am practicing in Pakistan and doing all and covering all the diseases related to the eyes. With my fellow Dr. Suhail Chaudhary, we have started our campaigns in different cities of Pakistan, then expanded to different countries of the world, so that we have to provide this treatment free of cost to the poor patients. So as they told that we came earlier in Tanzania twice, then Kenya, and we were been in discussion with the Overseas Pakistani Global Foundation from the last 6 to 7 months on organizing, on arranging these eye camps in Uganda. And they were regularly telling us about the issues, the health problems related to eyes that the poor patients and peoples are facing in Uganda. So we spare our time and we tried our best and we come here and we will be here and we will provide ourselves our best services to the patients. And being a surgeon, as I am the surgeon in this team and I am doing the surgeries for the patients having cataract, we are mainly focusing on the cataract, which is a reversible cause of blindness, but if it is treated on time, because every disease has a time, when it goes beyond the time it explodes. So I'm here, I'm being a surgeon, I operated here and treated the patients, and the thing that I'm going to tell you and conveying you that the surgery I am doing here to your patients, to the poor patients, free services, it is treatment is up to mark. There is no discrimination in a one world, second world, third world. It is up to mark. It is you can say the latest technology that I am using in surgery, and it is free of cost for all the patients.
Everything is free.
Everything.
Nothing to worry about. There are no conditions attached, no strings attached whatsoever.
No.
That's interesting, and I hope Ugandans abanyoro banga baropa barungi abanyoro kati abariha antekanize no bwire nkabuni niko kaire bana basaha bunyina bali basaha bazovimero jungu baitu kandi omusaho Hassan kuruga agambire ali musaho kuruga mu yanga ya Pakistan omusaho mukugu muno akukora hakusemeza ali musaho akolesa ebyome byomuli obyomutindo gw'amaani kurante yasobola kuba anasemeza muno abantu abalina obuzibu bw'amaiso yagamba nti buli kibakora kyona it is totally free of charge. Tibakusaba kasente koona, tibakusorora mu nganda, tibakusorora mu iyo boraboine kizibu boraboine omulwaire bagenda kwani bagambira okusobola kumuleta nka hakura nti basobola kwani bakuyamba. Understand they will be in the country for some quite a good time. Baitu kandi ngenda kwani pereza omaiso aho omuntu mukugu muno musonga zino zokura nti ya asobola kuba nabo nakura nti abantu batungi tibakweta. Ngenda nawo kwani mweza kabisa at him studio akuba na yangira. But first I want to go to one of the people I have liked most. Very humble looking man. And he's in his old days. He is fit to be my grandfather, if I can say. And a very humble one. He looks so humble. Even when I met him, I must confess, he looked a humble one. Dr. Riyaz, you're most welcome. And this is Bunyoro Television, where we mind much about the lives of our own people, especially our audience, who we believe are people that don't have the bigger chances. We so much serve the audience that is too local. And when I talk about the local audience, we talk about the people who are incapacitated financially. And like you said, you offer services to people who don't have the financial muscle to push themselves up to where they should probably be getting such services. And it is the reason I must confess I had to welcome you in studio so we can talk about this. And it is now your time to introduce yourself over to the audience.
Thank you very much, Kenneth. My name is Riazuddin. I am retired from US as a microbiologist, and for the past few years I am working as a volunteer doctor as a general physician in Pakistan. And during the past few years we realized Dr. Chaudhary and Dr. Shah here, we realized that there is a lot of need for poor people to help with them for reversible causes of blindness. So, as my colleague doctors mentioned, that cataract is the most frequent cause of this reversible blindness, and it's easily curable and it's completely curable, and the cure is very simple and successful. So we realized the need in Pakistan, and we worked there for the past almost 10 years, and we are doing 2 campaigns every year, almost serving 5,000, 6,000 people with their reversible blindness. Then we were approached from Tanzania, and we went to Tanzania for the same reason, and we found out the same thing with Tanzanian people, that they needed surgery, and there were lots of poor people who couldn't afford private treatment, and we were happy that we were able to help them. Same thing with Kenya, and then we were really blessed to meet overseas Pakistani foundations people in Uganda, and they invited us that we should come and help them here to see if we can provide the services to Ugandan people. So there's a major role of overseas Pakistani foundation to arrange this campaign we are going to conduct, or we are conducting and going to conduct in Uganda in future as well, hopefully. So we have conducted only outpatient clinics here, and then only 1 surgical camp so far, but we are going to further areas which I am not even familiar. There are names that I cannot pronounce. African names are kind of strange for me, but we are going to rural areas where we understand that there is much more need of surgery and much more.
My own village.
Yeah.
I will have to come in my
Maybe
own
we
village.
can go to Kenneth's village as well if he makes good arrangements for us.
Please, I will. Kale abantu baita balunga baroko abasajja bunyina bali basajja bakubukandi bakugamba nti bakulenga omuno kulwa nti bakuhereza obujanjabi bw'amaiso obwabusa mbagambire gaira haminya bagamba nti omuhali abantu bana bunyina ali omusaho omukogo muno kandi yasobire kuba enyuma aho nankwata mu mbeera yange ya maiso nkabanyine ekizibu kya maiso nawire buno kulura ebera buli timbi ya maiso baitu kandi akasobora kuba wena batayiba yabanda batali hano kiro kinu bakasobora kwani banjanja bakurungi nyasobora kandi kuba nyikira. It is one reason I keep saying, and I will keep telling you people, these people are here to offer a free service. Which free service? I must implore all of you to come and make sure you bring out your patients. If you have someone, I am sure there are many people who have been calling me since yesterday when I announced in this very show today we shall be having people, guests, talking about this camp, the eye camp they have, the eye surgery camp they have brought in Uganda. And most of you have been calling me, some of you are testing, giving me messages on my social media platforms. I am sure before we leave studios, you will have all the answers, and for those who will not have answers, I will still encourage you, give me more messages so I can be in position to explain and probably guide you where you can be finding them in the due course. And at this point in time, it is about 26 minutes past the hour of 7. Mugenda kunyikiriza nsobole kuba ningenda mu breather, and I will only invite my producer. You'll only give me a bumper, and we have to switch. I have to switch one of the guests. I have one more important person I want to bring onto this show, and please give me a bumper, my producer in there, so I can have my other guest take his own seat. Vision. My name is Kenneth Nwajira Moti, and in studios this evening I told you we have enyata bwongo Christmas special, where I chose to bring you these interesting visitors in today. And we are looking at the issue we are looking at is something that so much affects most of us. I know there are many people here out there with sight problems. People have issues with their eyes, and most of them don't know they have sight issues actually. And there are people who will tell you, in our African setting, we have very many beliefs. We have very many beliefs. I remember when I was growing up and I used to tell people that I had the sight issue. They used to give me very many reasons and probably wanted to give me very many kinds of local medication, which did not help me out. And I was advised by one of the doctors some time back. He's a South African doctor. He actually happens to be an Asian who works in South Africa. And he told me, I am lucky I did not use most of the herbs like I was recommended to. Otherwise I would have lost my sight. And having people like you who are the most experts in this field, it really gives me a lot of hope and courage that it is upon me now to push hard and make sure we disseminate such information to the public so we can have a generation that does not have sight problems in future. At this particular point in time, I want to invite my good friend here who has a name that I first gotten issues with in terms of pronunciation, but I can able to pronounce the name Ifutika Sikanda Chema. I hope I am very correct.
Yes, please.
You are most welcome to the show. And ono msaija omukurora he hano mukono gwango ulio ali msaija arengero muno kurora nti buli kimu kyona n'abana abasaho batalibaye basobola kwane baruga mu mahanga nambari barugire kuruga mu United States of America, kuruga mu Pakistan, kuruga mu United Kingdom. Ali msaija akuruga mu Pakistan, but I can able say he is now a Ugandan. And it is something that most of us must be proud of. He is one of us. And I am sure Ugandans don't even want to talk about the colors. For us, we are people, we are hospitable enough.
Sure.
Yeah, you will bear witness. He is one of us, at least for them we can say they are guests, but for him he's one of us. And when I was interacting with him earlier before, he told me it is one reason he had to make sure his friends back home, the other side of home now, happens to come to his new home, where he is, where he has been for the past, I think, 20 or something years.
Yeah, two decades, more than 2 decades.
More than 2 decades. So you really are Ugandan. So we want to understand, what is this OBGFA? What is it about? How did you even develop ideas of starting it? Because we are now, some of us are enjoying the fruits of, probably, I don't want to say your thoughts or your efforts, but you will be in position to tell us. Dr. Ifutika, not Dr. Ifutika, Ifutika Sikanda Chema. He is on room Sajat and Kireho, Oluge Runukuran to Kiren and Matriki. You're most welcome on the show.
First of all, thanks for hosting us, OPGFA, Overseas Pakistani Global Foundation of Africa, and our team from abroad. Actually, also I'm hosting them as a Ugandan. I was born in Pakistan, but now I am Ugandan. I'm your big brother. I was born in Pakistan. I was not born in Africa, but Africa is born in me.
Wow, that's a good statement. Akugamba nti akazalibwa mu Africa, bali tukande Africa kamuzalibwamu. Interesting.
Now, Overseas Pakistani Global Foundation Africa is more than 30 countries in all around the world. But I proudly say we have head office here in Uganda. So around East Africa, we are working closely with our other chairmen in Tanzania, in Kenya, in Uganda. So we have a different type of services. In health, we have free ambulance service in Kenya, Tanzania, Uganda, Rwanda, Burundi. In East Africa, we have like 25 ambulances. 7 of them we have delivered, and most of them, inshallah, next year we have to deliver all around the East Africa. After that, we have in Kenya and Tanzania blood donation camps, free medical camps, and also in Uganda now we have started free eye camps.
Part 3.
You see, I have requested them from UK, our brothers, Overseas Pakistani Global Foundation, Mr. Sohail Chaudhary. We requested them, please come. You have visited Kenya, you have visited Tanzania. You have to visit also my country in Uganda and provide us the best service. They have experience more than 20 or 30 years in European countries. So we have to get benefit. My local community will also have to get benefit.
So someone would want to understand, what really prompted you to invite these interesting doctors to our country?
Yeah, very interesting question. You see, we have to give maximum service, maximum health service to our communities. So we need also foreign doctors. So we have requested them, they have come. I have to say special thanks, and also I have to say special thanks to Government of Uganda, Ministry of Health. They are very cooperative with us. Without them, we can't perform anything in Uganda. And now we have started from Uge district. After that we was in Jinja. Now 2 days we are there at Malago Hospital. In Muke we have started screening. Jinja we have started screening, but here Malago Hospital we start surgery also after screening.
Okay, abalungi akugamba nti mu Uganda sofa balinamu kampu 33 kampu zino zikuyamba kurati za janja abalwaire bamaiso. Yagamba nti akasobola kanatandikira mu Nyamasaza eya Mayuge kwenya mu Busoga barugayo basiri mu Kakande bayijjaho side za Haihi bagenda mu city eya Jinja basobola kuba ni ba connectinga yo services ezimu. Yagamba nti munu akabamu screening niko kukebera kurandi bayitabura obutoki bwo bakumurikira mu maiso bayitegeza biki ebikuruma. Then kutandika for the past 2 days you've been at Mulago.
Yes.
Ebiro bibiri enyuma kiro kya ijo ne kiro today you were there today?
Yesterday and today, tomorrow also we will.
You are there. Okay. Ebiro bisatu ekaijo kiro kinu hamuna nyingi. Biro byona bagenda kubimara Mulago kandi kiro kyaijo nsobere kuba ni mukayirwaro ya Mulago nyarora abantu engeri baline bagamba nti mali obujanjabi amaiso bakubwetaaga akandi nyarora n'abantu ababaire barugire mu theater nyabaza huno abamu bangambira ebintu okusemerera okuba bire nabo hano kubire kyamaani munamuni bangamba nti bamazire emyaka batakulura baitu kandi basemeze ibwe abuni bagamba nti at least bakunihira nti bara mazire kubani bakira ebihoye baina mazire kwasemeza bagenda kwa kandi bagaruka mu kubani batunura kulungi. And I want to now go to Dr. Sohail. How do you find this mission so far?
I'm happy that we were able to serve the people of Uganda, and we found them very cooperative, very patient, and I'm happy to say that with these patients, they are taking our advice seriously, and in spite of various delays, we had to stop surgery because of the time limitation, and they came back the next day. And we hope that in future we will organize bigger camps and will benefit more people.
Okay. So you're literally saying time was not enough to operate all these surgeries? Or?
No, because we started late, and then we had to finish when the hospital time, official time was finished. Yes.
Okay. I go to my other friend, Dr. Hassan. That is the easiest name for me, at least, to pronounce. You are a surgeon.
Yeah.
I want to understand, since yesterday, you came in yesterday for the operations. That's when you started at Mulago.
Yeah.
Yesterday and today.
Yeah.
How many people have you so far worked on?
We have operated so far more than 100 patients.
100 in 2 days?
In 2 days.
And you will still be there tomorrow?
Yes.
So what is your expected number that you think, okay, if someone would want to know, if someone hears of 100, they sound like they're many. I want to understand how the numbers were in relation to the number you worked on yesterday. Because if it is 100 by now, in 2 days, we have to take a ratio of 50 per day. 50 yesterday and 50 today, at least. So how do you find the numbers, and do you look at them as being positive to these surgeries, or there are people that feel, because I understand, and this one comes from me. The first time I was told I had to be operated, I am one person who first insisted. At least I can still see, even when I have the pain. And I had that belief that when I go for an operation, I will entirely lose my sight. Do you still find people with the same attitude like I have confessed?
No, basically, here everyone have to understand that, as you know, the ratio of cataract that we are doing surgeries here, in the world, the ratio of the cataract is 10%.
10%.
Of 100 people, there are 10 patients who are diagnosed with cataract. But here in East Africa and also in Uganda, this number is increased and is 50%.
50%?
50%.
Someone might want to understand, what are these cataract issues you're talking about?
Cataract is basically, everyone has his natural crystalline lens in the eyes. And that crystalline lens become foggy, become blurred, and there is fogginess in the eyes and is difficulty to see. First, his distant vision is disturbed, then after some time he got disturbed in near vision, and then he got, his cataract is matured and he got totally blind. So this is a cataract. And patients having diabetes, patient having any other secondary diseases, old age patients, traumatic patients, trauma to the eyes, and these patients always suffer from cataract. So main important thing, what I think here is, we have to educate the the patients, that they have to come up and check up their eyes, whether they have these problems or not. Because the ratio of cataract here in this country is very high. And I can't say that there is lack of treatment here, because everyone is doing his best job. But if the number of cases and like this increases that much, so everyone has its limitation of work. So the number of cases are here very much, and they need to educate the patients that they have to come up and check their eyesights, why it is down, why it is up, what's the problem with it. They have to come up and check themselves to the doctor.
So in other words, there is no specific cause that one can say, I can avoid this to avoid the cataract issues.
Yeah.
There is no specific cause for now.
Specific cause, basically old age issues is the main cause, the diabetes is the main cause. Many of the patients we have screened in our eye camps, they have uncontrolled diabetes. I don't know why. Are they taking medicine or they taking not? That's the reason. Slight with regarding to health, the patients are not more educated. Then what is benefit to them? They have to go to doctor for checkup. They can take medicine on time, so that these things cannot exaggerate more.
In other words, the level of sensitization is still too low. That is your observation by now.
Yeah.
Okay. Dr. Riaz Udon, my very good humble friend. I will still refer you to the humble person in the studio after him. Now, I have one question about the kata. I am much taken up by the kata. You know, here in Uganda, when someone comes up and says there's a sight issue, they would always refer to allergy. People will say, maybe you have allergy. You are allergic to something. Allergic to probably coldness, allergic to air, allergic to wind. Is it the case that whoever, because I am sure here in Uganda, 90% of people who claim, who come up and say I have a sight issue, a common person will tell you that is allergy.
Yeah, we have seen patients, lots of patients, they come in and they complain about irritation of the eyes. The eyes become red, eyes become swollen, and they cannot see properly, and they have itchy. And lots of people are allergic to dust or dirt or sometimes smoke or sometimes other things. Sometimes they know about their allergens, sometimes they don't. But the only important thing is that they have to know what's the problem, and then they have to take accordingly precautions. I found out a few times that there were youngsters, like young boys who are riding motorbikes, and they're not wearing any glasses or helmets. So their eyes are totally exposed to all the elements in the atmosphere. So they might get this dirt in their eyes, and then by mistake they can rub their eyes, and it can damage the very sensitive corneal part of the eye and conjunctival part of the eye, which can eventually give rise to bad vision. So they must be aware of their allergens, they must be taking care of the eyes, and they must take some medication to avoid those allergens. And the medicines come in the form of tablets as well as eye drops.
How about, because me and you are putting on specs now, I want to understand if, for example, I happen to put on specs that don't suit my eye capacity, and this is a common practice.
It is, yes.
Across. It is not only to the common people, even the educated people. Someone loses his specs, moves immediately and buys other specs. People that are riding and driving, they have the eye shades, these are the lenses.
There is a lot of people that approached us in last few days. They were having refraction problems. As you said, they need spectacles. So some of them, they were aware that we have bad eyesight. So we advised them that if you are not wearing glasses, you know your eyesight is bad. If you are not looking after that, it's only going to get worse. So we try to educate those people who are visited by us, and try to explain the importance of spectacles, and most of them understand that they need glasses. Most of them said, oh, I used to wear glasses 2 years ago, but I'm not wearing them now because I broke them and never got a chance to get them new ones. I don't know how expensive glasses are here.
Very expensive.
But if you need them, it's a must that you have these spectacles, and don't use the spectacles off the counter or off the shop without having a proper prescription for the eyes. Because everybody's glasses are different. Some people have more than just short-sightedness or far-sightedness. They have the curvature problem, they have the angle problems, they have other problems that they must be seen by a qualified person, and they must have a good prescription so that they can protect their eyes for longer time and not become disabled or not become, they should not have bad eyes in the end. So it's very important that they should look after their eyes and have proper prescription for the eyes.
Interesting, interesting. Quite a good submission from my guests in tonight, and they are telling us, my name is Hansonga ya abantu inywe, my border riders out there who are watching right now. If you have a friend that puts on shades, we always call them the shades. That's our common name. Abakujuara ebirahuri ebitali bya size ya maiso ganje n'amaani ga maiso. Bairaba abasaho bano bakugu, and they have told us nti bokujuara ebirahuri ebitali bya amaani ga maiso ganje. Amaiso go kwano ga exposinga kwandi kurante gatunga. Ebizibu bya amaani muno. Dokuranchi mu maiso ogenda kusanga kando ga kyarora obujanjabi otabwini. Edakika ziri 14 ezikubudo kandi kuika saha ibiri. Ngenda kuba ninyikiriza amasimu. I will allow a few calls, and if you have issues related to this particular show, I will be allowing in a few calls, and those on WhatsApp tonight. I will not read your messages, but text messages I can see some messages are in here, and I will be reading some of your text messages, and I will come a few calls. Kimanyire abamu rurimi tumurukengere baitu kandi noburawa otiro kabazo mu rurimi runyo rutafuayo ngenda kulenga muno kuranti yakutera mu rurimi olujungu no kuranti kandi abasaho basobora kuba ali bakugaruka. The first caller has come through. Okay, Kali. Hello. Oyuruki. Okay, I lost this one. Sorry. You can call again. And if you have a question, bw'olaba oyina ekintu kyona kyokwenda kukabuza abasawo nyina line abasawo bali basatu then nyina ono omusajja ono alinga coordinator okola nti buli kimu kyona yasobola kuba nikibaho ngenda kuba nibagambira mu maiso awo kale ntandikire nayo. Hello? Yes, hello. Atagira kabina muntu, yes. Tata webali nayo kubaho. Amina mno webali kunyenda. Yes. Hoima. Kati bagenda kwa nakugarukamu. Oh, you so much want them in Hoima. Yeah, okay. You are inviting them? Bakuriye. Okay, he's one of... Kare webali. Okay, atagira kabina muntu. He's one caller and he's calling from Bunyoro. That is Bunyoro's capital where we are getting the oil. That is we call it the capital, the oil city now. And like he said, they are working in most of the cities in Pakistan. It is one of the cities in Uganda as well. Apart from this capital city, we have other cities like you saw Jinja. You will see Masaka when you go. Those are some of the cities we have in the country. Let me first pick up this, so I will be able to translate later, and you will respond. Hello? Oh, sorry. You can call again. At 783 0. You can give me that line. I see. Okay, 0783 064 458. 0783 064 458. That's a number you can call, and if you have any questions, if you have anything you want to ask my guests, please, you can call in, and those with messages, I will be reading the messages in a few minutes to come. But Atagira Kabina Muntu, I was asking and requesting that you also consider Hoima. Hoima happens to be the oil city, like I was telling you. It is an area that has, it neighbors the Democratic Republic of Congo, the other extreme side, and it is a really nice place where you should also consider, and probably have the team go to Hoima, and that they are like Doctor promised. You will be near at my home now. At least my people can come through, and they meet you over there. Hello? Yes? Hello? Tata nkuhura. Nkuhura tata. Ndikulunga sibiroti. Kando teriro. This one is a lost caller, unfortunately. She's asking who I am, and she called in. And of course, let me check through the messages very fast, and okay, this one says, thanks Ken for the show. I am Alfred from Kasese. When will the free camp be ending? Okay. Dr. If Tika will respond to that. This one says, okay, this is an irrelevant message. I won't read it. It's too political. It is not for this show tonight. And this one says, thanks for the show, Mr. Programmer. I kindly beg that these people come to Bunyoro so we can also enjoy their services. Otherwise, I appreciate. Okay, this is Shamim Naiga. She's another journalist, and she's tuned into the show. She says, Ken, thanks. These are the kind of shows we so much want, and how I wish my people get to know about this as well. I will have to give them a call. Interesting, Shamim. And okay, I don't want to waste much time. I will start with you. Let me pick these other calls. What time? 1 minute, 10 minutes do I still have? Okay, hello.
Hello.
Tata. Aha, Kabuza. Alina account muliso hagati ni wo hotel yinka.
Account muliso genina account wabale zakalo right? Adimba yinka. Asokola sukari yao hametoka katawa tawa ni mbeto yanga.
Taksola kuruga. Buya buno linka. Kenjojo bakwesero? Tusimeme, okay? Ngenda kusaba ikala TV osobole kwa nohore no kugarukamu. Ya karibana. Okay, where do you find okay? Kale bagenda kugarukamu. Amina, kale. Hello? 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 You're not speaking, let me pick some other person. Hello? Yes, hello. Yata. Nayo uri kulungu. Uri TV okwehura. Kale nawe je bali mami. Baitu kando ya TV soko girugize tubaze wangu. Oli ku TV soko osembere kukala. Aha, yogera. Nawe je bali mami. Baliwa. Baliwa? Otegeeza ki tubayita tutya? Basawo. Basawo bw'oba oyagala kumanya tubayita bano basawo. Hello? Hello? Yes, hello? Yes, atagira kabi bwangu. Akasundu haliso. Nikakuroresa ku. Lero manya akasundu baketa batamu rujungu kale nketegereza. Kare. 1, 2 last callers. I only have about 6 minutes to end the show. Hello? Tata. Hello.
Hello.
Yes, I can hear you. Bwambale, yes. I can get you right. Sorry?
I was to ask them already in studio.
Yes.
About the standard, about the eyes, because we were talking about the glasses that we should avoid glasses that we are putting on.
Okay. Glass standard.
That they may take our eyes.
Okay. He was only saying you need to go to a doctor so you can get the right specifications for the glasses you have to wear.
Right.
Yes, I can respond to that as well. I have done that. Hello? One last caller. Hello? 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 You are praying around. Hello? Hello? Yes, speak up. Kisembo Matthias. Ekya aliso. Hagati mu liiso, yes. Akafunamu ke kiki? Okay. Akafuna ke kintu mu liiso hagati kirinke kiduli? Oh, okay. I've taken note of it, Okay, Hoima. You can hear most people are calling in from Hoima. Almost everyone is saying that I have about 5 callers who were asking a common question. I think time is not my friend. I will have to producer in there. I think I will need to borrow your next very few minutes. I don't want to go far, but because of the urgency of the matter and people need their responses, I only have 3 minutes to end the show, but I will need to borrow a few minutes in the next show so we can have these questions responded. Let me pick this last one. She's been calling in. Hello? Okay, hello? Definitely, yes. Hello, you are on your television. Yes, yes. Oh, so sad. I've lost you. And you had a question I must... Hello? Yes, please. Akaire kandekere yanguya. Harungi chari. Nina iwe bari. Bwangu rabambwangu kako nabira rubaraza. Very unfortunate, I lost you also. I will not pick any other calls. The first caller who called in and was like he's inviting you to Hoima. I called again and he had a question. He says, I don't know how to call it. He has like a pimple on top of his face, his right eye. He says he has something that really gives him a headache in terms of sight. And he was asking how best can he be helped out. It's not a pimple per se, but it's something more of a pimple. It's a black spot on his eye, and it grows every other time. It grows big, keeps on growing. And he says it is affecting his sight. So he was asking how best he can be helped out. And to see Mary from Kianjojo, you were asking, she says she has a child who also has a sight problem. She says she has a child who has something like, it's more of a swollen something in the eye. It is a swollen muscle, I could say. A swollen muscle in the eye of this daughter. She says her daughter has a sight problem. She has something. So she's asking how best can she be helped? Where can she find you if she's to be helped? That is another question I got. And then some other caller, I did not note your name. You also say, okay, this one was asking about the glass standards. Doctor talked about it. I don't know if I probably responded well, but I will give you an opportunity to respond to him as well about the eyes. He was asking on the glasses, which capacity, how do they, which doctors do they have to go to? Is it every doctor that they can go to? Is something that they need to have right
Kenneth, I'm not aware of local opportunities that they have here. You can maybe answer better that. The opticians are the guys who help with the prescriptions classes.
Yeah.
So maybe they can go to any standard hospital over here, or maybe there might be some optician shops who check the eyes for the prescriptions, and they have along with the glasses as well. They can suggest the glasses and the prescription at the same time. So that's all I can say. And another message I would like to convey is that eye is one of the most important organs in the body. Don't take any home remedies for that. If you have any ailment, if any sickness, any problem with your eyes, with your sight, with your eyes physically, go to a qualified person and have it checked out. Don't use any home remedies or this thing helped my friend, so I should use this one, same ailment. No, it's not. It's not safe. It's not safe. Always seek the help that is qualified people, and always seek the professional help. Nothing, home remedies don't work. Most of the times they make the problems even worse. Okay, so that's my message to the people, that if they need glasses, they should get glasses. If they have any problem with their eyes, go see somebody who is qualified. Okay. No home remedies.
Okay. Bwambale bakugarukiremu bakugamba nti toyina kandi kuba anogenda kutunga obujanjabi mu bantu bonna bokasangira. Yagamba nti okwali butaka kugenda abasaho marwara gamaani yabeeta opticians banu abantu abakujunanizibwa na glasses mbicheke bipawona. Bogenda marwaro referral hospitals, most of them azina eye care centers. You go to those eye care centers, ask for those doctors, tell them your problem, bagenda kuba ne bakuyamba bakugaruke mebibabuzo byawo nengeri olina kwanga otungamu ebirawo. Inyo abantu abagenda ne mugula bugulebera bule mukasangire aboko musana gwenge okwenda kuteka shades bayiraba amaiso gawo kuba nogakehya amani gago nogachekya nomanya nyinki ogenda kwiga kaye utakusobola kuba one of my presenters here is a culprit. He's good at putting on shades here, and I always quarrel with him. Why do you just put on every other shades we find? And I think he's now had Aronika Hoho, so we're going to Muropayo, Maiso Gawasa. And okay, that one is responded to. The other two questions, actually, there are two questions almost related. Dr. Hassan.
Yeah, the first one who called about that he has some swelling on the eye.
Yes, on top of his eye.
Yeah, on top of his eye. I would suggest him if that swelling is increasing in size. If it is stable, then nothing to worry. If it is increasing in size, then you have to go to a proper doctor, ophthalmologist, and give a checkup to him or her. Because if it is increasing in size, then
So you only say
means
it gives him a sight issue.
if it gives a sight issue, then he or she had to visit the ophthalmologist properly, and they have to investigate what the issue is, it is increasing day by day, so they have to excise surgically or by any medical treatment needed.
Okay. Then Madame Mary also had the kid. Says her daughter has...
Yes, one thing I want to tell the audience about the kids. Remember about the kids, if you feel or if you see any issues, any point you think that there is some issue with your child or with your kids, go straight to the pediatric ophthalmologist and check their eyesight, because in kids, if you don't give proper follow-up to their eye checkup, there will be no treatment when they get bigger or older. There will be no treatment for their eyesight. So you have to go there and check up your children to the doctor.
Interesting. Abantu banga Mary tusime ali kyenjojo ohabuzegene kabuzo kindi no gamba nti obujanjabi buno okusobola kubuyanka. Mary okusobola kuha agabusa bagambo awapa agabusa okwena nyokweza agabusa bayira bora abanosobola bora abanu wesobola ka transport no kasobola nkusabira omwana ogwo muyimbe kiro kya nyinkya osobole kubona omuyota hirwaro lya mulago bana abantu kiro kya nyinkya bagenda kuba hirwaro mulago nikyo kiro kigenda kuba lekisembayo hirwaro ya mulago batandikire bijo abantu abajanjabire byabusa tokusasala bino lwatano baitu kandi ngenda kusaba bora abano osobola ka transport akubayiraba omwana mulete bamujanjabe nayo omuntu wena roko akusobola nkimanyira mulago abayinga kasenete mukasobola baitu kandi nasendezo kujanjaba omulwaire wa maiso nazo zitaha nyingi muno bwire buno bora bwina kantu akaje okusobola kwano wefereza kulwa nti omwana rundi iyo omuntu mukuru waija basobola kwano kujanjaba nkukusabire kandi nkusabanye na nyehomba kire muno cyari nyakusabira osobole kwano lito mwana atagera kabina muntu munywani wange kimanyire rero we bora osobora kujja Kampala ngenda kwani baguza bana abantu kandi kwenda kulwana muno bana abantu mbalesire n'ensonga yokurura nti nkwenda mbambisirize muno nkwenda nduwane nabo kuranda at least mu bunyoro basobola kubana batereza y'omugisa bayije abana bakujja ahirwaro lya Oima Rifaro batuyande basoboka batereza obujanjabi nakyo tuganyirwe ebiteka bindi bikutunga baitu kana byenkwenda nduwane muno n'abantu bano ninkwatagana omusajja ono munywani wange hano asobole kuba naleta abasawo bano kwiti baija buli myezi mukaaga mu ihanga muno bayije kandi tusaba nkwenda at least butulata hata imitebo bwire muno mu myezi mukaaga yokwija nayo tusobole kuba ntufebwaho muno abaitu kandi nkwenda kubanza mbahereze omugisa wamaliyo embazo zaabo niko tusobole kuba etumalira Dr. Chandri. Yeah, Dr. Chandri. Overall, for the little time you spent in the country, how do you rate our own medication in terms of medication and awareness about the eyesight, and what do we need to do to have it very much improved to standard?
Right. I have observed that a lot of people who need glasses, they're not wearing glasses because they cannot afford them.
Wow.
So there should be facilities where they can get subsidized glasses. Second problem that I've noted is allergies. Because of exposure to wind and dust, there are a lot of allergies. And again, the eyes are neglected. Just simple sunglasses are not worn. I noticed that very few people are wearing glasses, even when they are riding motorbikes, they're driving, they're not wearing the glasses.
They don't care.
They don't care. So these problems can lead to chronic irritation in the eye, which again, by rubbing or just by staying there for a long time, can damage the eyes permanently.
Interesting. Thank you so much. And one simple question before I forget and we leave. Dr. Hassan, You talked about the issue of cataract issues before they get past normal. When do these cataract issues go to a stage where doctors can't afford to have them maybe brought back to normal and someone is operated to get back to normal?
As far as cataract is just like an age. With the time it grows bigger, it becomes mature, becomes harder. So once you have cataract, just go for the surgery, go for operation, because it is a curable, 100% curable disease.
Wow.
And if you are just feeding the cataract, it gets mature, and at a time when it gets mature completely, it changes to another permanently blindness that is known as glaucoma.
Glaucoma is not curable.
Is not curable.
Okay. Thank you. You've really responded to my question. Dr. Mwabuzi again so Uganda nti aragambira nti endwara ya maiso eyikakaire etakyasooka kandi kuba nejjanjabwa. Yagamba nti bw'olaba olina ekizibu kya maiso bayiraba linga omuno kuseera abasaho otunga obujanjabi nkokola nti kandi wasobola kuba n'otunga ekiiko etanzi. And finally, I have about 2 minutes. I am already into 10 minutes of someone's program coming up next. If you take Chema Sikanda, the founder of the organization that has done so much for the people of Uganda to have these wonderful doctors. He says he's a retired doctor, he's a youth like me, though he has eaten a lot and he's kind of fat, but at least for him he's still serving and energetic. But these two wonderful gentlemen here, they are people who have retired, and I want to say before they get tired, can we please have them in Bunyoro sub-region? Can we please have them in Hoima like my people were calling in and asking? It will be, even if I say tomorrow I am retiring journalism and I no longer have to sit in these shows, when I have people like you visit my area and at least have some people there worked on, will honorably retire in peace. Can we please have such services extended to Bunyoro? And I will need an answer from you. Face the camera and tell us.
No, that we noted now, Hema and Bajor district. Inshallah, next trip, next year.
The next trip.
Nah, next year.
Yes.
We will visit also there.
Interesting.
Yeah. And we are our this free eye camp started on 7th December, is going to end 30th December.
This very one here.
This very one.
Okay.
We have still 14 days. And inshallah, after 31st December, maybe visitor have to go back.
So this one is going up to 30th
December.
So after Mulago, where are you going?
We are going for Sarji, Muke, Jinja, then Masaka, then Lira.
So after here, I will request you give me that program because there are people who are calling in and they are not in a position to come to Mulago tomorrow because it is an abrupt program for them. And now that we are in the festive season, they have to plan. So I will request you give me your program for the next few days coming up.
Sure.
So tomorrow when I come back for this show, I will dedicate my 10 minutes of the first show to tell people where to get to the service. Because people were calling in. I am sorry not understand the language, but it is one reason you have to sit in and translate some of the words. They want these services as much as the first people wanted. So you will probably have to help us. So your last words as we set out.
We will share you the all details with you.
Yes.
Then you can give it to the ID on the. Please, how Dr. Chaudhary Riaz say, please, eyes is very important.
Very important.
Part of the body. Without eyes, if we don't see anything, sometimes I don't have glasses. I cannot read mobile. I cannot read the books. How I have to get glasses, and how people don't have cataract surgery. After some time, how they have explained, they come to glaucoma, they can't see properly, they come at blindness. Please take care of your eyes. It's in your hand. When you drive the boda, just please wear the glasses.
So next year, which month is the program coming? So we can prepare in advance.
We are just preparing the plans. We are just we have here dispensary, free of dispensary. Then for the clinic also, for eyes clinic. Then we register there the members. who need cataract surgery. When it's reached 500, 600, we shall call our team. They will come for 2 weeks, 3 weeks, and they will serve all of our commodities.
All right. Okay. You've really answered most of my questions. You can see people are still calling in. I want to give 5 seconds each of you to say a word before we step out. And I will start from my far right. Just 5 seconds.
Okay.
Yes.
Thank you very much, Kenneth, for having us here. And it was a good opportunity to introduce ourselves to the public of Uganda. And I just want to say to them that please look after your eyes. If you have a problem, seek professional help.
Interesting.
For 5 seconds, I think best is thank you, Uganda.
Thank you, Uganda, the part of Africa. Indeed.
Yeah.
Dr. Chandra?
Yes, I thank especially the Overseas Pakistani Foundation for calling us here and to arrange this program, and we hope that we will be able to have this program again next year and in the coming years.
Interesting. Iputika?
Please, and again say how our doctor says, please take care of your eyes.
Okay, these are the people. Ladies and gentlemen, my good audience out there. Chairman David Mihans, the chairman of the OBUJANJABI Uganda, earlier on sat in the show, and of course he had to say hi to everyone. And it is high time. I said thank you for coming. Thank you indeed. Uganda is so much proud of your services. This one I must open up and say we are proud of your profession. We are proud of your good heart. Thank you for coming through. And Iftika, thank you for making this happen. Thank you for first and foremost bringing them onto Bunyoro television. Thank you for bringing them to Uganda. My fellow Ugandans, my brothers and sisters, have so far, a few have already benefited, and I am quite sure before they leave the country on 30th, or before this program comes to an end, many of my brothers and sisters will have benefited from the same project. And I am looking forward to having you in Bunyoro the next time you come to Uganda. He says mid next year will be here. I am one of the people that will have to welcome you at the airport. And that one, if God gives me a life, I will be there to welcome you next time you come to Uganda. But for now, allow me to say thank you for coming. And my audience out there, munyikiriza barungi, nsobole kuba nimba asibuli hano. Amasimo gakyali mayingi, nkwenda kusaba nyenkya saha bundabani ngaruka mucho. Nkwenda mbanze kwata ya masimu ebihabuzo byange bikwenda kwijja nyenkya iyo barabota kunungire mu gisabo kwijja kaire kandekere buleke dakika ziri 15 zinyaka iba musaha eno erabiri asaha ibiri baitu kandi nyenkya dakika zange zikubanza kimu ngenda kwata amasimu uraboyine kinde byo tetegerize kurungi nkusaba nyenkya saha emu kika saha emu dakika 20 ngenda kwani kwata amasimu mungambire bike mwakwetagire kurandi yesoda kwani mfikia abantu banu kandi utunge ngaro kwamu munyikirize saha zinu mbendezo kulala kurungi and God bless you.